Finding a right medicine is art and science where we have to symptoms we have to analyze. What are the most peculiar symptoms to be identified in the patient? So we are categorized into a first is mental PQRS, physical PQRS, pathological PQRS, and local PQRS. So mental PQRS associated or alternating symptoms with the mentals and physical generals. These are considered to be a PQRS. Psychotic symptoms of mentals, syphilitic symptoms of mentals can be considered. And the main cause is emotional or mental cause of the disease can be considered. Unusual thought patterns like delusions, hallucinations, fear, and sensations can be considered. And the dream is the one of the mental PQRS where we can observe. Coming to the physical generals PQRS, considering first the physical cause of the diseases is the one of the best PQRS. Five senses like smell, taste, hearing, touch, and vision. These are the most peculiar symptoms to be observed. And alternating physical symptoms like one symptoms alternating with the other physical symptoms or associated with the other physical symptom. Sexual and menstrual complaints are to be considered as very peculiar. Sleep, perspiration, urine, stool, appetite, desires, aversion, thirst, thermal are to be considered in a physical generation. How to find we'll discuss later. Periodicity, time modalities, and general modalities has to be considered with the PQRS, and a pain sensation for two reasons. And physical symptoms persist for a longer duration, which are like 1 year, 2 year, 3 year, and not noticed. And negative symptoms, abnormally missing symptoms considered. Next, third point, we are coming to the pathological PQRS are the unusual discharges. Unusual discharges are considered to be a PQRS, and functional, structural, and destructive pathology are to be divided and considered for a devising of the pathology. Two pathology associated, two organs are affected, those are considered, and origin, duration, and the progress of the pathology. Origin, progress of the pathology. Example, nephritis after malaria. These concomitant symptoms to the pathology. Concomitant symptoms to the pathology like diabetes with joint pains. These are concomitant pathologies. And next we are going to a PQRS of the particular location, sensation, modality, concomitant. These are the some important points we have to note down in case of a case taking, and according to that we can find very easily the medicines in a repertory. We'll discuss later in our studies. Thank you.